Welcome to Innovation Beauty Retreat 2024. So it is a big pleasure for the aesthetic team to have in these 2 days a big part of our partners along with us.
I'm here, first of all, yes, as an ambassador, but before being an ambassador, I am a client. I am a woman who has needs. Being an actress, it puts you in front of a camera 12 hours a day when you're filming. So that means I'm the kind of woman who always search for technology that works, that delivers immediately and visible and sustainable results.
Thank you very much, Monica. Well, today we're going to address issues that we all have once we reach the age of 50 plus. Because everything goes well, you can do whatever you want till the age of 50. But once you turn 50 plus, hormones start to play a role, face started to change, and the game is not the same anymore. Take, for instance, Botox. We started Botox in 1991. We saw after 10, 15, 20 years, we saw non-responders, we saw altered mimics, we saw people with serious atrophy of the muscles that we didn't see before the age of 50. The fillers that accumulate hyaluronic acid, we know they don't disappear. They don't even disappear when we dissolve them with hyaluronic acid. They just fragment and move in the face. And they attract water. Once, twice, 3, 4, 5 times their volume, and the volume keeps augmenting. We call it the pillow face. Skin tension. We heat the skin, we needle the skin, we do a lot of things, and after a while, if we use too much heat, we might see atrophy of the deeper tissues. Deep dermal pigmentation is a very serious problem that we cannot tackle with a lot of rebounds. And last but not least, the vertical liftings. We're all trying to achieve liftings, but we never achieve them really because we don't activate the muscles the way the human body is designed to do that. So we don't want these images anymore of botched Botox. We don't want these pillow faces and augmented volumes. These are people who didn't choose that type of volume. It came later. They asked for a few ml and it continued to swell till it got these type of proportions. Now for those who followed my presentation yesterday, they know how I came to all of this. because my daughter married the son of a famous radiologist, and we started to analyze under the CT scan what's happening inside. And surprisingly, what we are dealing with and everything that we're trying to solve are not the real culprits of aging. Aging happens through muscles that deteriorate. After a while, they start losing their volume, they start losing their tone so they don't pull on the bone and we lose bone, and they start losing their capacity to relax after each contraction, and they remain in like a static, involuntary contraction. When we look at the baby, he can have as many contractions that he wants, but after a second, it all comes back to normal. And we will see why this is the case. And we'll understand also that the facial shape is in fact the main hallmark of youth. And this facial shape depends essentially on our muscles. They build the volume, they pull your skin upwards, and they create the relaxation. If young people have a face that is upward, it's not because they're happy, it's because they have a good muscular tone, okay? And the skin overlaying all of this takes the credit in front of the mirror, while it really doesn't deserve any credit at all. It's a layer of less than 1 millimeter. Less than 1 millimeter. It cannot take the credit for the whole volume of our face. That's why I call the muscles the Cinderella of beauty. They do all the work and they don't get the credit. Now, we understood all of that after a few decades of injecting 300 patients a day. So what really made us think is the Bell's palsy, because in the Bell's palsy we see the nerve attacked and the muscle drops down. And that's where we understood that it's not the skin, because the skin is the same age. It's not even the bone. Bone didn't have time to atrophy. It's the muscular tone and volume. So these muscles, they depend on the nerves. And these nerves have to be in great shape because they contain Schwann cells and they need it for propelling the message at a rate of 120 meters per second in a two-way street, which means there are nerves going from the brain to the muscles, and they are attached there with thousands of receptors till the middle of the muscle, and then the muscle talks back to the brain and sends messages every millisecond to understand what's going on, and the brain adapts himself. If this two-way street, this two-way highway of efferent and afferent nerves is not synchronized, a lot of bad things happen. One of the bad things is we lose our tone and the face drops down. We lose our volume and we replace it by hyaluronic acid. We lose the ability to relax after each contraction, and we try to block the communication by injecting toxins at the level of the receptors with the muscles. So here we have the brain and the muscle and the two-way street. Now, to activate a muscle is not by an external device that is connected to the skin that gives impulses to the muscle. No. It's by activating the connection and restoring the connection between the brain and the muscle in the two-way directions back and forth. Now, we understood that these nerves don't deteriorate by themselves. They have living cells, Schwann cells, and they depend very much on microcirculation. And that, in fact, this microcirculation feeds the nerves. And the nerve have another function, is to activate the removal of toxins by the lymphatic flow. All of this together made us realize that, in fact, we have three major organs that are connected with all of our body through afferent and efferent pathways: the brain with the nervous system, the heart with the vascular system, and the intestines with the lymphatic system, where the blood flow is in fact the one who's driving youth. They all go together. We have 10,000, 100,000 kilometers. That's 2.5 times the circle around the Earth. And that keeps us young and healthy. We call it homeostasis. Everywhere in the body, we've got sensors. These sensors detect any damage, send it back to the central organs, and these central organs give a command of repair. This is our self-healing through the loops of biofeedback. The central command is electric, and we understood that because they generate electricity. Electroencephalogram, cardiogram, and gastrogram. Yes, it does exist. And these electrical impulses run on electrolytes. And everything starts with the weakest link of all, which is the microcirculation. And I'm talking microcirculation. Red blood cells need electricity and electrons to catch the oxygen molecule, because otherwise they cannot catch it, to release the CO2, to travel fast without friction, to fold in the capillaries, and to push each other forward so they can reach back the heart. Because the heart is not a muscle that pumps. Otherwise it would have looked differently. We have a very short circuit to the lungs, and we have a very, very long circuit to the rest of the organs, and the two ventricles are the same size. Doesn't make any sense. Hemodynamically, it doesn't make any sense. But the heart has different functions. It's to activate the red blood cells. Now we're going to listen here to Professor Senef from MIT, the way she talks about the red blood cells and the capillaries.
So when that system falls apart, lots of bad things happen. So here's a picture, very schematic, of red blood cells traveling through a capillary. They're very crowded in the capillary. It's a very tight squeeze. They decorate themselves with sulfate outside their cell, and they deliver that sulfate as they pass through the capillary. They shed it, and they're therefore shedding negative charge. And that negative charge is then building up along the capillary wall. And it's very interesting because as they do this, by the time they get to the vein, and all of them are shedding their negative charge, this creates a battery between the artery and the vein, which then actually propels the red blood cell through the artery, through the capillary, because it's attracted to the venous side because of this battery. It's attracted to the cathode, and that will pull the red blood cell through so that the heart doesn't have to work so hard to pump. And furthermore, these layers, these sulfated layers along the wall of the capillary are very slick jello. The red blood cell can just slide through almost frictionless effort to get through that capillary. When these things break down, the red blood cell gets stuck and you have a no-flow situation. So basically this voltage change that's created by the red blood cell itself actually drives the red blood cell through the capillary and makes the blood flow properly.
So in fact, the red blood cell is an electromagnetic train, like they have in China, who travels 1,000 kilometers an hour without any friction through this whole circulatory web that we have, and that's why a small heart of maximum 80 watts can run this whole system. Okay, now we'll see a little bit what this is video microscopy, what it does in a normal state, and what it does when the red blood cell is charged electrically. And this is the essence of life and rejuvenation. Without that, forget about rejuvenation. We're only creating an avatar of ourselves. That we are electric is already known. There are Nobel Prizes, books for that, etc. So this is literature you can follow. And now we're coming back at why Hollywood went to natural about 2012, the same time that I realized that my patients were not looking the same anymore. They were 50 plus, because we started early, we did a lot of them. And then we looked what's happening. Things that we now know, that hyaluronic acid remains, doesn't go away, while the muscles vanish. At a certain point, the balance between the substrate, that way we inject the hyaluronic acid in, which is the muscles and the bones, etc., around it, this substrate vanishes and the hyaluronic acid remains, which creates this bloated face that we get where we replace muscular volume by hyaluronic acid. And this continues to grow. Here we see Tom Cruise in 2021, and that's the moment that he took to remove it, a very dangerous procedure, which costs a lot more than injecting, has to be done with a lot of precaution and with a lot of risk, because 20% can develop autoimmune diseases by doing that. Okay, now, we see the central organs, and the connections between them. As we age, and we live now 50 years more than 2 centuries ago, we don't need that healthy anymore. And these loops that connect the central organs with the peripheral organs, they start to degenerate. And they cause aging. We call it neuropathy, vasculopathy, and lymphopathy, and we see that all our aging process starts to go very steep from the age of 50. So while between 20 and 50, we could do whatever we wanted, heat the skin, heat the dermis, inject, put threads, whatever we thought of, Botox, not Botox, from the age of 50, we have to really think things through, because the structures underneath are not the same anymore and they're not stable. That electricity exists, I will not talk about that today, and the way our device works, I will not talk about either. I find it much more interesting that we understand what's happening within our body. Now, we have also electrical connections between the cells, which is extremely important to keep the cohesion of our organs. Otherwise, they disintegrate and they do not produce anymore what they have to produce. Extremely important for the skin, extremely important for hair follicles. And we see that lecture is already there. Everything I'm telling you is PubMed published, etc. So we've got a lot of information, a lot of studies on our website. So we need to understand that rearranging and reconnecting the ion channels between the cells is extremely important for healthy tissues. There's another thing that is quite important that we don't know. Everybody talks about PRP, but for those who know how PRP existed, it's orthopedic surgeons who started that, because they didn't have a blood flow in the cartilage and in the bones and in the tendons. That's why they started doing that. So they took blood, they centrifugated it, they took the platelets and they injected and they tried to traumatize to create thrombin and to release the growth factors. But we in aesthetics, we have plenty of blood in the face and plenty of blood in our hair and the scalps. So the only thing we have to do is try to activate it. Turns out that activation through electromodulation is far more powerful than taking red blood cells and taking platelets and traumatizing them with thrombin. So for us, it's a total nonsense to do PRP. We have 600 times more in existing platelets that are ready to be deactivated, and all this is published in very highly rated scientific articles. So what are we doing with this PRP? Now, what is electromodulation good for? We connect the 3 loops with the central organs to repair our organs. We have a cell-to-cell connection, and we create a PRP-like effect, which is much more powerful without any trauma. But there's another thing that is very important. As diseased tissues have a different electrical resistance, we can have a selective electromodulation which restores tissues. And we use that, for instance, for acne scars, for phototype 5, Indian people. And look, you cannot ablate them. It's very complicated. You risk post-inflammatory hyperpigmentation. But what you can do is, with electromodulation, benefit from the difference in resistance in these scars and get a rejuvenation. And you see that the whole area rejuvenates, also under the eyes. The same will be valid also for open pores. A very complicated thing, but with electromodulation, a very easy thing, because you benefit from this selective resistance in these areas. So we're tapping in our own resources. That means we have a very complex and very intelligent mechanism and technology within the body. We only have to repair it properly. And we went from surgery, did a lot of liftings, a lot of hair transplants, etc. We went not only to natural, but to activate our self-healing mechanisms. And there are a lot of indications. We have over 60 indications. In fact, every organ you can reach is yours to rejuvenate. So we're dealing with face, facial muscles, etc. We're dealing with hairs. We're dealing with neuropathy, sexology for men and for women, urinary incontinence mainly, articular problems and sports injuries, etc. So, the skin. What's going on in the skin? We have fibroblasts that are living cells, And these living cells are, of course, connected with nerves, they're connected with the microvasculature, and they're connected with lymphatic flow, and they age. When they're old, they're making old collagen. We call it new collagen when we stimulate them. In effect, no. Our grandmother, who was 80, will have in 6 months new collagen, which is exactly the same age, 80 years and a half. And that's why she will never look 20, even after 100 cycles. Okay, so you'll still remain this old collagen. We have to renew the factory, not stimulate the factory to produce a new production, which is as old as the factory itself. That's number one. Second is this whole skin. I don't even talk about the epidermis, which is 1.1 millimeter, about the dermis. It's really nothing. We talk about the thin layer that has no significance. It's on a fascia. And this fascia has significance. Even the hyaluronic acid it produces, has no significance at all. When we look under the skin, we have a fascia. And this fascia gives us stability. The fact that our palm can open the lid of a jar is because the fascia there is much stronger. We cannot do that with the skin of the inner arm. And this fascia is connected to the deeper fascias. And this deeper fascia is connected to the ligaments, the retaining ligaments, to the tendons, to the muscles, and everything is hung up on bone. And this is why our face is lifted and in nice compartments. When this goes wrong, because of hormonal effects, because the vasculature is not okay, etc., everything starts to move and to shift. In such a territory, if you start to inject whatever you do, whether it's hyaluronic acid or botulinum toxin or whatever you're going to do, it doesn't have the stability anymore. So you will get very funny faces after the age of 50. You need to build up the substrate underneath to get a nice skin. Now, why is it so important? Between 20 and 50, you're all great. That's not a problem. From the age of 50, you all have enough money, children are grown up, your house is paid, and you want to benefit from a great life till the age of 85. And that's where you pay the debt of all the errors that we did in our youth between 20 and 50. So that's a shame, and we should not allow that. The fascias are important things. We should pay much more attention to healthy fascias and restore them. They are full of nerves, they're full of vessels. The retaining ligaments in the compartments of the face, extremely important. Without them, where are we going to inject? And the muscles underneath who pull up, the jawline, etc. Okay? So, after 50, watch out for the fascia, the ligaments, the muscles, the bones, and a little bit of fat pads. The skin, the fibroblast collagen, and the hyaluronic acid is of less importance. And loss of volume of the muscles, tone, and relaxation after each contraction becomes paramount. Because look what's happening. We say the face is sagging through gravity, but it's not true. The face is pulled downwards by a platysma which is over-contracted because it's old, and it's lifted upwards by the frontalis, which is over-contracted because of the age. It's not gravity. It's up and down because of the muscles. And we see what the muscles are doing. The small levator muscle of the eyelid. If you start stimulating the nerves towards that muscle, you get a blepharoplasty without operating. And that has been proven time after time. We recuperate even the botched Botox, where we get this lower upper eyelid, which drops down. Okay? We get an open gaze, open eyes, something that is very difficult to do, because we need the frontalis up, we need the levator of the palpebrae up. The midface. We talk a lot about the midface and filling it up, but what fills the midface up is the muscle. Look what happens with the zygomatic muscle when it goes up. It fills the cheeks. It takes away the jaw. Okay? The lips become bigger. They become more contracted. Nasolabial folds disappear. Marionette lines disappear. The eyelids, upper eyelids, become round and up, while the eyebrows go down, something that is unheard of, and the orbicularis get really stretched. And we get rid of malar bags. You see what's happening to the frontalis. The frontalis gets more volume, gets more tone, can be relaxed, and still the eye is open. Same for the lips. Nasolabial folds. Nasolabial folds are not a lack of collagen. They are a zygomatic muscle that pulls inwards. So we have to go inwards and relax the nerves to these muscles. And how do we do that? By resynchronizing the afferent and the efferent nerves. Lip has a volume through the muscle, has a vermilion that needs to be activated through microcirculation, and the fine lines on the lips diminish. So even if we fill the lips, we still have work to do on the vermilion, on the muscle, and on the philtrum, which brings it up. The neck is not only a matter of platysma. As a matter of fact, it has to do with all these muscles between the hyoid bone, the mandibula, and the tongue. And these are the muscles to take care of from the inside of the mouth. And with electrical drainage of the lymphatics, we deal with this mass that we have. As long as it's not organized, it's very easy to do. Once it's organized, you will need more sessions. Same thing here, okay? So, same thing here. The face changes, the volumes of the face changes. Scars, what we see here are scars of acne, dark skin patients. Look at pores, open pores. What they do, they close quite quickly. Look, the pigmentation around the eyes and the quality of the skin, the whole area regenerates. Not only the color, the warts go away, xanthelasma better, even the eyelid goes better. Armpits that are dark, this is more our work of India. Relaxation of the muscle after each contraction. This is what we have to do, because if we continue to inject Botox without restoring the nerves, we will end up with atrophy of the muscle and resilience to Botox. It will not work anymore. Melasma, which is an inflammatory problem, and the inflammatory problem needs to be dealt with before the pigmentation. Deep pigment in the dermis, extremely complicated to deal with. We cannot even start dealing that because we will have post-inflammatory hyperpigmentation if we go with a Q switch or whatever. Malar bags, complicated area of disturbed lymphatics, disturbed muscles, everything. The whole fascia, the whole ligaments is there. Look at the lips, at the same time they grow. Very old skin, older ladies. This lady doesn't want any surgery, any laser, nothing. Okay? But if she continues doing the sessions, she will improve a lot. These are aggressive treatments, more aggressive treatments, where you use high concentrate of glycolic with the infiltration, with the activation. Look how the muscles change your facial shape, and this is really youth. This is something that I could not do while I was operating and doing liftings. My liftings were not vertical, although I took the SMAS with me. No, they were not. They were certainly not dynamic. They were not vertical, and they didn't involve the bone because the bone still continued to atrophy because there was no pulling on the bone. So now we will see that your assistant can perform a dynamic vertical muscular bone lifting that you can only dream of as a plastic surgeon. Here we have the dermis restored and the smaller vessels diminish. This is a lady that I showed yesterday. She's herself a doctor. She's 70 years old. She didn't want anything but the natural one. And look how the face changes after 14 sessions and 8 months, how this verticality and the restoration of the tissues come aboard. This lady is also a doctor, and she doesn't want any injectables. But look how she starts to change over 6 months of time. This has been sent by a colleague in Bucharest, okay? And look at the hollowness of the eyes, the forehead, the contraction of the muscles, nasolabial folds, the lips, everything changes. And I'm sure there are plastic surgeons here, and I have been doing thousands of liftings. You cannot achieve that. Not this verticality and not with the dynamic, because when she moves like when she was 30. And this is important. Scars, of course, cellulite. Drainage, electrical drainage, activation of the skin. And we know that microvasculature that improves removes fat, because fat accumulation is through lack of oxygen. Okay? So there will be new methods coming out where we will inject electrons in the fat in the future. Mind you, okay? You're all sitting here. The future will be injecting electrons, solutions which had more electrons, to activate the red blood cells for a better uptake of oxygen. And through that, improve the metabolism of your fat cell. Write this down, okay? Because this will be your future. Electrons and oxygen in the cells. After 1 year and a gain of 1.5 kilo, still the effect remains. Mallet bags, a very complicated area. We have ligaments, we have muscles, we have lymphatic flow, we have the skin, we have pigmentations. A lot is going on, okay? So mind you, our problems that we have now can be solved. We'll go to hair and hair loss. There are a lot of causes for what we call androgenetic alopecia, but a lot of them we cannot solve. The genetic we can't, the DHT we can't either, because it's very dependent and very sensitive, and the DHT to our genetics. We are genetically predetermined if a little bit of DHT will make us lose our hair or not. So it's very complicated. You have to reduce the DHT nearly to zero to have an effect, and nobody wants that, okay? But on terms of vasculature, where we can increase the microcirculation, oxygen uptake and release, there is no treatment for the moment. Connection with the nervous system, with the bulge and with the bulb, with the stem cells and with the melanocytes, doesn't exist till now. Lymphatics, drainage of lymphatics, does not exist anymore. Inflammation, cutting down the inflammation, nothing really hard to reduce the inflammation, and the cell-to-cell connectivity either. What we do is we inject, and we inject peptides with copper. But copper should be uptaken through the food or through food supplements, okay? We inject peptides that activate melanocytes and activate the stem cells. But it's the nervous system who does that. Why do we have to go from the outside? It's like doing the homework of our kids. How do we expect them to finish school and to be intelligent if we do their homework? This is what we've been doing. Okay, so look at what's happening here. All these connections have to be reconnected and refed, okay? And what we are doing is we inject the little bit that we have, we try to inject it instead of asking the body to deliver it himself by the normal structures. And we take for that a very nice tiny instrument that we believe is very soft, is a needle. A needle is between 0.25 millimeter and 0.30, which is 3 times the size of your hair follicle. 3 times, as a sharp, thick needle. And you start there injecting in your scalp, cutting one follicle after the other. Now, try to do that immediately after a hair transplant. It's not very intelligent. Okay? And certainly not if you have hair follicles that are not in extremely good shape. Why do you need this needle? To bring what? Things that you can bring through your microcirculation, and the oxygen that we really need is not brought through that needle. Okay? So, we're dealing now with 6 essentials. Microcirculation and oxygen, connecting the nerves, draining the toxins, degranulating the platelets, reducing the inflammation, and connecting the cell-to-cell, and not only reviving the hair follicles, but also prolonging the anagen phase. Okay? We've got 5 programs in that. Hair growth, HEA, that we all know. Hair loss is telogen effluvium, that you all know. But also hair repair for people who have damaged hair because their healthy hair follicles couldn't resist extensions, bleaching, perms, or even a hair dress that is too aggressive and pulls the hair backwards. We have the hair protect after hair transplantation because we don't want to lose our natural hairs around, otherwise the follicles will be visible. And we have the hair youth. After women spend thousands and thousands on their face, they end up with anagen phases on their hair that are not even and shorter, which means that their hair needs to be cut shorter in order to be normal. So the hairdresser tells you, we'll cut your hair short, it will be nice. And then you have a haircut of somebody who is 60, while you spend a lot to create a face that is 30, okay? So with a program which lengthens your anagen phase and rearranges it, it's a lot better. You see a sleeping hair follicles on the right, inflammation on the left. All this is what we want to cut away. And in a very non-invasive way, people feel good. They can even sleep much better after the treatment. We add to that food supplements. Why? Because our food actually is hyper-processed. It doesn't contain anything anymore. So you can have everything from food. if you eat normal biological grown food, but it doesn't exist anymore. 75% of the food that we have in supermarkets doesn't contain anything. It's called hyper-processed. So, hair growth, we'll see a few pictures a week later, 2 sessions later. We do the sessions with a week interval, okay? 6 sessions. We need 8 sessions for HEA. We need 4 sessions for hair repair, etc. Okay, and then you see how the hair grows, and it grows with the same inclination, the same distribution, the same density, the same design, because it's your own sleeping hair follicle, so you will never see that it's different, while a transplant never have the same inclination, doesn't have the same distribution, doesn't have the same angle, not the same density, and not the same thickness. So you will always see that it's a hair transplant. Okay, so that's why you need to camouflage it among regular hair. Okay, there are tons of pictures. You can see them on our website also. This is after 1 week. Look at the white hairs that are coming out, you see, and they will get pigmented later on when the melanocytes will be activated. Hair repair, hair loss and hair growth. Women works very well. Men on the receding hairline is the most difficult part. You need to associate to that needling and rosemary oil, but needling definitely. Okay, the needling, they can do it themselves. You don't have to go with your Dermapen or so needling. Okay, this is also after 1 week. This is very complicated. It's blonde people where I live in the north, okay? And look how they look like after 1.5 months and after 6 months. Now, 4 sessions, these are, look, this is exactly the same position. You can see the hairs. They have exactly the same place where they are, okay? So this is what you can expect. And after 6 sessions, it's completely fuller. And this is after a hair transplant, okay? This is Frédéric Landy. And Frédéric Landy is the art director of Dior. He was the right hand of Galliano, huh? If you remember. Well, and he went to Antwerp. He lives in Antwerp. He did a hair transplant. He came to me and he said, I want you to inject PRP. I said, I'm not going to traumatize your newly hair with needles and PRP. We're going to do electromodulation, okay? And so we did it, super happy, and although he's famous, he makes publicly and openly publicity for us. We never asked him to do that, but he's really happy. Another thing, we nearly finished, gynecology and andrology. We talked a lot about dealing with the organ themselves, the urethra, the lining of the vagina inside, etc. But what we tend to forget is all these organs are connected with nerves, and they run through vessels, and these nerves, they come from the sacral nerves, S1, S2, S3, S4, and they are connected to these organs, and these nerves are deficient. So for men, we can correct the urinary urges at night, urinary leakage and bladder issues for women, erectile dysfunction and dryness. But mind you that erectile dysfunction and dryness also depend on the hormonal factor, okay? Not only on the nerves. The tone of the pelvic muscles, pelvic pain for women comes very often, and the orgasms, which we call the Valentine treatment. Okay, how does it work? Well, you got the nerves that are coming from the lumbar and sacral area, and they are connected to the detrusor muscle of your bladder and to the sphincters of your urethra, the voluntary and the involuntary. And when this is connected, full control over your urine, and this happens from the first session on. And it's not me who are testifying about that. We have famous gynecologists, presidents and vice presidents of gynecological societies, professors at the university, who are telling me we didn't have one failure in urinary leakage, which is coming from the urges, bladder urges, or which is coming from stress incontinence. I have these testimonials on the website, so it's not a problem. You can hear them talking about that. And these are prestigious people. You cannot buy them to talk to you. We correct also the pelvic floor. We deal with the pudendal nerve. We heard this, I believe, this morning about the pudendal nerve. There are enough studies on the activation of the pudendal nerve in an invasive way. It happens by us in a non-invasive way. And with the pudendal nerve, you correct a lot of your perineal situation, okay? Urinary innervation here by men with a prostate, okay? And they see it from the first time on. They see they don't have to wake up 5 times at night. They wake up maybe 1, and then after a few times it's over, okay? So urinary flow, 4 sessions, 4 weeks, result after the first session, 100% of the patients respond, okay? Very important to understand that. Sports injuries. For sports people, people with frozen shoulder, etc., frozen knee, works extremely well. Why? Lymph drainage of the fluids, anti-inflammatory, PRP regeneration, nervous connection, okay? Microcirculation, all these factors play a role. Arterial ulcers, extremely difficult to deal with, okay? Dermatologists here will understand and know that. And ulcerative psoriasis. Dermatologists that have seen that, because it's quite rare, okay, know that it's not a picnic and it heals within 10 days. So, what is the future of beauty? For me, the maintenance of the fascia, ligaments, and the muscles, and a little bit the skin, through an improved microcirculation with more oxygen. Our first problem, what is our first problem? Our first problem is statistics show that only 5% in our age group is really ready to do all the invasive stuff, and above the age group of 45, and you see it here, these are American statistics from official sites, above the age of 45, they look weird. So we have a problem in the 50 plus category where we need to think differently. And in the lower category between 25 and 45, at least 1 on 20 wants something different. They are afraid of that. They don't want that. Okay, intuitively they understand that something needs to be done. Our second problem is we have very difficult and really impossible indications that we cannot deal. And I'm talking about deep melasmas, sensitive people. I'm talking about the eyelid, upper eyelid. I'm talking about the eyebrows up, the malar bags, okay? And many scars for phototype 4 and 5, okay? Acne scars. So all these things you cannot do with other techniques. Then we create what people want now, which means a mental experience, which means they relax, they can sleep better. We treat them in an environment which has soft music, fresh air with a little bit of scent, and you see the light is dimmed, and they relax totally. And in India, where we work a lot with it, we do them the chakras, the 6th chakra and the 7th chakra, and the first for the gynecology. They love that. And last, but really not least, it's affordable. It's affordable. People can pay that. We've got here 8 billion people on this earth, and the times when I started, I'm talking about 87, where only rich people came, it's gone. Now average people come with an average salary. You have to think about that. We have sustainable results, 100% clinical improvement, because the body recuperates slowly but surely, no side effects, no pain, no downtime, and 100% natural. My books are on the website, and I wrote a book on that, which is to download for free on the website. And I hope I brought you some new view on what medicine will be in the future, and I thank you very much.